Yeah, so we've started to touch on, I think, all of the issues, but just to reiterate, there's a lot of systemic barriers that have been created. So that includes stigma, lack of medical representation in research, and then bias when it comes to diagnosis and treatment. So to start us off with stigma, there's a lot of stigma attached to women's health issues. So this includes, items like contraception, menstruation, menopause, other gynecological health concerns. People are in general just uncomfortable talking about these issues, and that has impacts. So not talking about these issues reduces the general awareness of health conditions, symptoms, and it reduces funding for the important research and medical advances that are needed. And it might also mean that the women themselves are too embarrassed to seek help. Turning over to clinical trials, we've seen in the past, researchers have often excluded women from their medical research. They're worried that hormones would distort the results. They were also concerned about the unknown effects of drugs on pregnant women and their fetuses. Pregnancy risk is a valid concern, and they're right to consider that, but the approach of exclusion has left women with underrepresented portions in clinical trials and medical research, and left many pregnant people without access to medication when they need it the most. Speaking from personal experience, I had sinusitis when I was pregnant. My body was already really swollen, and then I was told that I could not take cold medicine to alleviate any of the symptoms because of the unknown effect it would have on me. So 6 weeks in, when I still couldn't chew food, I was really hoping that there'd be some medication and some relief. The bottom line is that female physiology differs from males in many ways, and treatments tested on men don't necessarily work well for women. And then this lack of research and awareness also means that health professionals sometimes dismiss or misdiagnose women's symptoms and health concerns. This can lead to delayed treatment or just insufficient treatment. Pain is a good example of this. Doctors are 2 times more likely to diagnose women with a psychological cause for their pain rather than a physical one. So gender bias in chronic pain diagnosis can result in women receiving little medical support and then, create some avoidable damage to their mental health. We are starting to see an increase in women in research, and it, better reflects women's health needs today, but it still remains largely underfunded, with less than 8% of national funding going to women's specific health research. And then in addition to these systemic barriers, women are more likely to experience other limitations, maybe access to transportation, childcare, or prohibitive costs.
Yeah, so access to support within the workplace, as well as healthcare generally, are really important topics to talk about, because there's a whole bunch of different reasons that they could be experiencing barriers. So we have self-stigma being a big issue. There's already people who might have been out of the workforce for different reasons. There might be people that have taken leaves for different reasons. Coming back into the workforce, they're already this feeling that they're starting from behind. And then on top of that, if you have a health issue, the stigma that's associated with that, and being fearful that you will face further repercussions or that you will face further delays in your career growth, are some of the reasons that people don't want to express what's happening with them health-wise. There's also the lack of knowledge from people around you. So whether it's the lack of knowledge of senior members of your team or other teammates about women's health issues and some of the things that women are facing, whether it's directly, related to health, whether it's related to childcare issues, whether it's related to different hormonal stuff that might be happening. There is a definite lack of knowledge that's happening within the workplace, and therefore with that lack of knowledge, not the appropriate supports, and again, a lot of blanket policies and blanket supports that are put in place instead of looking at the person as an individual. So I think it's a very layered, very, very complex, but an area that needs some more focus, because that access is such an integral part of people getting the care that they need, and helping to reduce those barriers with, whether it's flexibility on time, whether there's flexibility with childcare for appointments, or some of the easier ways that a workplace can help in that journey that a woman might be facing.
What we do get feedback on in our organization, what we've been trying to do better at is just disseminating what exists today in the organization from a benefits perspective and a support and resources. So a lot of the stuff can exist in your internet somewhere, but we lose sight of that and what's available to employees, and for their managers to know what's available so they can guide their employees in those conversations. Another piece is there's a lot of data that's out there in terms of how women are feeling in the workplace. One of the things we've been trying to do is actually get our own pulse on how our employees are feeling in the workplace. So one of the questions we do ask is on our regular surveys to our employees is, I have access to the resources and I need to support my overall well-being. And so we have a gauge on that from an organization perspective. We know that it has a strong correlation statistically to overall employee well-being because we measure that as well. And because you've got your diversity cuts and all the different levers in your data set, you can take a look to see where the opportunities lie in your organization, where we might need to dig a little bit deeper and provide some support. And that's helped to fuel our strategy as well. So those are just two things. It's not blanket. Sometimes it's pockets of the organization that need a little bit more support than others.
Well, it's a significant issue during the menopause continuum. And we have to ask ourselves why. When you look at support that women get during other phases of life. So there's definitely education and support during puberty. You get help to not get pregnant, to have your children, to deal with postpartum depression, to reintegrate into the workplace. But this time of life for a woman, really the support, care, open conversation, and dialogue disappears. And we believe that a lot of that is rooted in ageism and devaluing women as they get older. So when it comes to menopausal care, remarkably, even though this is something that is a universal experience, every woman will go through it. It's more than half of the population that will deal with this hormonal change, that will live in a state of menopause for up to half of their life. Our healthcare providers are not educated. They actually do not get the financial compensation to do appropriate menopausal care. So it's a very complex system and a complex challenge. But what ends up happening is that women are not getting the kind of health care that they deserve through their menopausal years, and that diminishes their quality of life, their health outcomes, and their ability to make contributions in ways that are meaningful to them.
Great, thank you, Janet. And Stuart, just curious to know if you've seen any legal issues or compliance issues on this front in terms of women not being able to get the access they need or the support they need.
Not directly, but I mean, the one thing that occurred to me when I was listening to all of the sort of well thought out, complex responses that my colleagues on this panel have given, I had a very simple thought as to why a lot of women aren't able to access healthcare or the support they need. And it's just a lack of time. So many women are, they have their full-time job or full-time career, and then they often have a full-time job at home as well. And so there just isn't time. So that was my very simplistic answer to the question. But, as I said, I don't see direct claims along these lines, but indirectly, it gets back to what I was saying earlier. All of the claims about the stress and anxiety and potential constructive dismissal really, emanate out of this issue. So indirectly, we are seeing a lot more claims, a lot more medical leaves, and a lot more litigation or threats of litigation that all arise out of these issues.
And Todd, could I just add something else in that I forgot to say?
Yeah, please do.
We launched a landmark report in 2022 called The Silence and the Stigma, Menopause in Canada. And the data from that report revealed that while women see their healthcare provider as their most trusted source of information and advice on menopause, when they actually went to their healthcare provider, only 1/4 proactively raised this in conversation. And for the women who took the concrete step to raise their concerns or talk about their symptoms, 72% found the conversation to be unhelpful or only somewhat helpful. And 4 in 10 left their healthcare practitioner's office feeling that their symptoms were untreated or undertreated. And what we hear over and over again from women is that their symptoms, their experiences going through this time of life are diminished and ignored, and that they're being told to essentially put up with and suffer through symptoms that can last for up to a decade or more. And we feel like the change is going to come when we close that knowledge gap, when women start to really advocate for themselves and demand more. And we're going to see this because we've got this huge generational shift happening where you've got Gen X women and millennial women who are online more, who are talking more, who expect to have richer conversation and dialogue about these topics that are important to them. So that is going to drive change not only within the healthcare community, but I think it's going to drive change in the workplace because their expectation of the employer and what they would like to see from the employer is very different than the generations before them.